Hi, welcome to the Lisa Saunders Show. I'm Lisa Saunders, and I'm really excited today because we are going to talk about why reading is so important to young children and what Connecticut is doing to help children read at a young age through particular programs. And to help us with that is Christine Garber, the Connecticut Executive Director of Reach Out and Read.
Hi,
Welcome.
Lisa. Thank you.
And we also have Aniella. Fignon?
Yes, Aniella Fignon.
Thank you, nice French name. Community Wellness Coordinator for the Community Health Center.
Yes.
And what is the Community Health Center?
So the Community Health Center is a statewide nonprofit organization that delivers primary medical, dental, and behavioral health care services for the entire family with a focus on special populations. We have 13 main sites across the state and over 200 school-based health centers, some of which where we deliver some of our great programs. So basically the Community Health Center is a place where you can get all of your services at once. They're all co-located. You've got medical, dental, behavioral health care, and also a plethora of awesome wellness services.
So I can go there and get my shots and
yeah.
look at my teeth, and you do all that together?
Oh yeah, all at once too.
And you said school centers, so they're actually in schools?
Yes, so
as
we
well?
actually have some clinics based in schools. Some of those centers have all of the amenities, medical, dental, and behavioral. Some of them have just dental, some just behavioral, but we are in so many different locations.
Now I heard you have two new centers in New London County?
Yeah, so they're not new. One of them is in Groton, located on the Gold Star Highway, and the other is located in New London in Shaw's Cove.
Oh, okay.
Yes, both have availability to take patients.
They do. So what do you do how do you get on? How do they go there? How do you go there?
How do they go there? Well, they can take public transportation in their car. But once you get to the Community Health Center, you can set up an appointment to be a medical patient or a dental patient. And there are also behavioral health care services if you're one of those. But really, you go there and you can get all of your services at the same place. So you have your dentist, your doctor, and your therapist all in one location.
Okay,
Yeah.
great. And how do you work with Reach Out and Read? Can you explain what you do, what Reach Out and Read does?
Well, do you want to just talk about the sites that we're at CHC?
Yes, so we are having the Reach Out and Read program at 12 of our main sites and one of our school-based health centers right now. And we basically think that this is an amazing program because it has tremendous value to our families. Children who are served by Reach Out and Read are not only receiving the intellectual and social benefits of early childhood literacy, but they're also demonstrating significant positive health outcomes.
Yeah, like I saw this article that you or somebody sent out in a newsletter from Reach Out and Read in U.S. News, the life-saving power of books. And it was showing, MRIs are showing that places in the baby's brain light up when they're being read to.
Right. So we've always known that the first 5 years of life are, it's when the brain develops more rapidly than any other time, really birth to 3. So it's really a critical stage in a child's life to learn as much as possible. So what that article was about was the MRIs. They would have an MRI going while the child is being read to, and you could see the parts of the brain that light up when the child is being read to. So it's really cool.
Really amazing. I mean, yeah. I got goosebumps when I read that. I had a very severely disabled daughter, and she really remained about 3-month-old for her whole 16 years, but I always read to her because she loved it. You know, I didn't know what she knew or didn't know. She sat in my lap, we read, and she actually knew this prisoner read about her in a magazine that was in prison. I guess it was sitting there for a couple of years. And he picked it up, and he wrote her like 10-page letters, and I'd read them to her.
Wow.
I hoped he never would find us and get out. But anyway.
Well, her brain was lighting up the whole time.
But I think her brain was lighting up because she'd smile. And in fact, one of the authors who you have some of her books, Tish Rabi. I was shocked that when my daughter was pregnant, I didn't realize in her house she had one of Tish Rabi's books that you read to the baby before they're born.
Before they're born, right.
So now I always read to my daughter growing up, and she's actually a professional writer in D.C. But this article was interesting to me because, like you said, because it's showing what's going on in the brain when they're being read to.
Right.
So everyone knows they should be, and this is actually saying they think this doctor who wrote the article wants you to be reading from books, not tablets.
So, right, yeah.
So tell me, you get books in your program? Tell us about that.
So Reach Out and Read is a national nonprofit organization, and we give young children a foundation for success by incorporating books into pediatric care and talking to parents and encouraging parents to read aloud with their children every day. So we're a national program here in Connecticut. We are in 72 clinical locations, so 72 doctor's offices
all over
per
the
se,
state?
all over the state. Deliver Reach Out and Read, and CHC is
When you say
one
CHC,
of them.
what do you mean? What's
Community
CHC?
Health Center.
I'm not going to let it get away with abbreviations on my show.
So they are some of our providers that deliver Reach Out and Read. So basically, Reach Out and Read is a pretty simple program, but it's really effective. So for children 5 years of age and younger, at their well child visits, their medical provider, so their pediatrician or their family practice doctor, is talking to the parents about, like I said, why it's so important to be reading aloud to your child every day, 15, 20 minutes a day. And then starting at the 6-month visit, through that 5-year visit, we give the child a new book. So we have some books on the table. So what we're trying to do is we're trying to educate parents and change parental behavior in order to get them to read more to their child. But we're also providing them with the tools to do that. We give them the books. We concentrate on children growing up in low-income communities or low-income families because research shows, and it's very clear, that they are at the highest risk for reading failure and school failure, and there are so many negative things that come out of being illiterate. So where the Community Health Center and the other locations that we partner with, they serve the Medicaid population or the uninsured population. So that's why we're in those types of clinics. We can really reach those families. And what's so great is
it makes a huge difference in the lives of our families. When a provider talks to a parent about reading to their child, they're 4 times more likely to go home and read to their kid.
Versus just hearing it on TV or something, how you should be reading.
Because they know that their doctor is telling them it's for your child's health. It's important. It's not just because you want them to get
I was
an A.
reading in this article, they're saying it's helps with obesity, and I mean, all
yeah.
these other,
my gosh,
how does that help with obesity?
Well, there are so many negative outcomes to being illiterate, unfortunately. Obesity, you can be health illiterate, where there are so many people in the United States that can't even follow the orders, by their doctors, how their treatment plan or their prescriptions. And so what happens is they become sicker, or they might become more obese, or they definitely have more health problems, and it causes health insurance to increase, and then it becomes really a cost that we all absorb.
Right.
Aniella might be able to explain that better than I.
Yes, so when you think about somebody who is health illiterate, they're not sure how to apply for insurance. When they do get that insurance, they're not really sure how to use it. They're not sure how to access resources to tackle some of their day-to-day problems that can really impact their health. So when you think about literacy and how much of an impact it can have on every aspect of your life, and how all of those parts of your life are really a part of your health and your wellness, you can see how being illiterate can really do some damage to your health.
Yeah,
So how can people help? Donate money for you to buy books to give out, or what?
So, all right. So we serve in Connecticut, we serve about 40,000 children every year through Reach Out and Read. Nationally, we serve 4.5 million children a year. We give out 6 million new books a year. We always give out new books because we're talking about young children, babies. They put the books in their mouths. We need them to be clean.
Right.
So in Connecticut, we give out about 80,000 new books every year. So we need to raise funds so that we can purchase the books or get donations for the books. In Connecticut, Reach Out and Read is mainly grant funded. So we don't get state funding at the moment, although we're trying to do that.
So who provides these grants?
So some of our funders are, most of them are family foundations, and then we have some banks that are funders. We have some corporations in the state that fund us, and then we have some small donations, individual donations, from people, and that's something that we definitely would like to increase and develop further. So how can people help? You can certainly go to our website, and we have a whole handout on how you can volunteer for Reach Out and Read. But
What do volunteers do?
So books, obviously, we give out 80,000 books a year. We need new books. So volunteers could run or coordinate a new book drive for us, and then donate the books to our sites that are giving them out, so like Community Health Center. They could do even traditional fundraisers, car washes. Kids can be involved. I always wanted kids in school to do a readathon, get an elementary school to do a readathon.
What would a readathon be, where you sit there all night for 24 hours or something and read, or what?
Well, I just think it's great, like kids reading so that they can help other kids learn to read. I think that's just a really nice thing.
What? How does that work?
So the kids do a readathon, and they get, their parents or their neighbors or their aunts and uncles to sponsor 10 cents a page, or
okay.
And then they, however the period of the readathon is, a week or whatever, how many days they do it for, and then they collect the sponsorships, and then the money gets donated to Reach Out and Read or whatever nonprofit they choose to. So donated funds would then go, we could, purchase books in order so that we can continue to give out books to support our program. So that's one way.
I love that idea. What better way to get more kids to read than to have kids reading?
We have not done that, and
that is a good idea, because then the kids can
be helping other kids,
while they're reading.
Right?
So how do you coordinate with Reach Out and Read? How does that work? You call them and say, we need more books? Or how does this work?
I wish it were that easy. We get a massive shipment twice a year from Scholastic, which Reach Out and Read funds everything for. And we purchase some books on our own. Basically what we do, because we're such a big main site, is we collect all of those books in one place, and we figure out what the age range is for each book. And we distribute those to our sites and the providers.
How many sites do you have?
We have 12 main sites that are participating in the program, and one school-based health center. We are hoping to expand in our school-based health centers, but it's a lot harder because we don't have consistency in providers there as much. So basically they get those books, they give them to each of the eligible children, which is any child 6 months through 5 years, at their well child visits, and the provider talks to the families a little bit about why reading this book is so important and how it can make a difference in your child's life.
So they have been partners with us since 1998.
Yeah. Almost at 20 years.
Almost at 20 years.
Now, it couldn't have been you this whole time.
Yeah.
Yes, from day one.
Aniella coordinates the program for us because, like she said, there's 12, so they have 12 different locations that deliver Reach Out and Read. So there's a lot of coordination that's sort of unique to their medical center.
Yeah, so I end up tracking a lot of data and figuring out what the best way to get over little hurdles in the program are. So we have turnover in providers because we have so many different sites. So how do we train them appropriately to make sure that they are talking to parents about the right things? How do they utilize their 2 minutes that they get to allocate to speaking about childhood literacy in the best way?
Right. So all providers have to be trained on Reach Out and Read. So when a new program comes on, or if it's an established program, but they have some new doctors, they need to take our training. So where they have so many doctors, it's great to have a coordinator, because then Aniella can tell us, okay, these 5 new doctors came on in the last 3 months, and she can help coordinate getting the training done that they need to do. There's also reporting. They do progress reports twice a year, and she coordinates that and collects the data for it.
Yes, I get all of the book distribution numbers from all of our sites, and I compare it to the number of well-child visits to see how each of our sites is doing, and then we report back to Reach Out and Read, and they let us know how we're doing.
And we have a program coordinator. We have 2 program coordinators in the state that go visit all of our sites, and so actually, the program coordinator meets with Aniella monthly, because they are such a large health center, and they troubleshoot. If we see something that we'd like to be improved, although Aniella has the data, she sort of knows too. It's all out there. They troubleshoot and figure out, okay, how can we do this better? Okay, we need a different site coordinator. So we're in constant communication, not just with them, but with all of our sites, because we want them to be delivering the best program that they can, because it's so important.
And how do the doctors feel about the program? Like, what do they say about it?
Our doctors love it. I mean, Aniella, I don't want to put words in your mouth.
So just one quick story. We had a doctor come on to our Waterbury site a couple months ago, and he learned that we had our Reach Out and Read program, and he was over the moon, because he said it was one of the best programs that you can offer in a family care facility like that, because it has, for such a little amount of effort, has such a tremendous impact.
So the doctors learn to use the book as a developmental surveillance tool. So when they go in for a well-child visit, they're looking for milestones. They want to make sure that the child is meeting certain milestones depending on the age. And what the part of the training does, and some of it they sort of learn on their own over time by being a Reach Out and Read provider, is they can use that book to get information quicker than without the book. So they can see, if they're looking for fine motor skills, they can hand the book to the child, and they can watch the child and see what the child does. And if the child is able to turn the pages, they know that.
Oh gosh, sometimes I have trouble turning pages.
They also, does the child know, depending on the age, of course, does the child know what to do with the book? So a 3-year-old, you would think, would know what to do with the book. But if a 3-year-old doesn't know what to do with the book, that's a red flag, So the doctor's going to look for other things. Is it simply that they don't, maybe it's a new family, they don't have books in the home, so the child hasn't been read to. But maybe there's some type of development delay, and that could tip them off.
Do the children seem excited to have them? I mean, do you get to watch them?
Oh, yeah.
Well, we don't get to.
I
don't get to watch them.
I haven't either,
because we're not doctors.
Right.
But from what I've heard,
they do get very excited, and siblings always want books. So we've actually started in a couple of our sites to offer bookshelves of free books for siblings who come in,
that's
so
good.
that they can also get books.
Right, because it's hard if you're giving the child that's coming for the well-child visit. If they get a book, you want to give the sibling a book. But also we've heard, they come in and, do I get my book today? And I think another challenging part is our program goes to 5 years old. So say this child has had Reach Out and Read since they've been born, and then they come in for the 6-year-old visit, and they're like, where's my book? So we do try to, when we get donations, from Barnes & Noble, sometimes they are for older kids, and we certainly give them to our program so that they can continue it, it's not the official Reach Out and Read program, but so that they can still give out books to the older kids, because obviously it's still important after they're 5. What we're trying to do at Reach Out and Read is prepare the kids so that when they get to kindergarten, they have those early literacy skills so that they're ready to go, they're ready to read once they get to kindergarten. And what research has shown is that kids from low-income families are typically behind. They're like 12 to 18 months behind.
Ooh,
they're more affluent peers, and it's really hard for them
behind then.
really hard for them to catch up, and really expensive. The programs that the schools need to do in order to get the kids caught up are very, very expensive. Where we're sort of like preventative medicine. If you just read to your child every day, 15, 20 minutes, 15, 20 minutes a day, expose them to books, they're gonna get that literacy development, those pre-literacy skills. They're going to understand text goes from left to right. They're going to know the letters of the alphabet. They're going to know their sounds. You don't, as a parent, you don't have to teach them to read. You just need to expose them to books and read to them.
So kids who are served by the Reach Out and Read program are actually scoring 3 to 6 months more advanced than their counterparts. So that in and of itself
Really?
is just very
Wow.
substantial evidence.
For you holding the data, that's pretty exciting data, right?
Yeah, it is.
It is. We have 15 independent research studies that show that kids that participate in Reach Out and Read during the preschool years are ahead in their early literacy skills. It also shows that they have more books in the home than non-participating kids, which obviously makes sense because we're giving out books. And also that parents read more frequently than parents that are not part of the Reach Out and Read program. So we have great outcomes data. We have the research on it. We also have the American Academy of Pediatrics, the AAP, and they are behind our program. In 2014, they released a policy statement. They're sort of the authority on all things pediatrics, if you will, the Bible on it. And they said that all children, not just low-income children, but books and literacy should be a standard part of pediatric primary care from birth for all children. And they cite Reach Out and Read as the best practice approach to doing that. So that is huge. It's huge that they cite Reach Out and Read, but it's also huge that they recognize the importance of literacy in the health environment, which is what Aniella was talking about sort of at the beginning, about how many things in your life are affected if you can't read. I wish I had brought the stats with me, but it's a big number of parents that are not. I don't want to misquote. But
I'm not sure what it is on the overall level, but I know that when we got our statistics back for our own sites, we are hoping to get parents, about 75% of parents is our goal. For the number of parents that we want reading to their children. Of course, we'd like 100, but 75% is the goal right now.
Right.
But there are all sorts of variations of that statistic. Some of our sites were reporting that parents were only reading to their children 50% of the time, which is not great. Other sites had really wonderful statistics where parents were reading to their children over 75% of the time. So
the goal is for parents to be reading every day. But nationally, with illiteracy, I mean, it's a big problem here in the U.S. And there are so many parents out there that can't even read a simple bedtime story to their children, or that don't purchase don't even purchase one book a year, or don't even read one book a year as an adult. And so what we're trying to do is change that and get kids reading early, so that they are literate adults, and then the cycle it's how you sort of break the poverty cycle. I don't mean to make it so simplistic, but if now you have more people graduating from high school, and now you have more people going to college, and you have more educated people, and that can earn higher wages, that's how you start to break the poverty cycle. And then they're going to read to their kids because they know that it's so important. So that's really where we start. We start with the parents. It's really important to read to your child. And you know what? If you have trouble reading, just make up stories. Make up stories about the picture, because that is a problem. Some of our parents, and I'm sure you guys see it,
Absolutely.
They are not comfortable reading because they're not comfortable readers. They're not confident readers. So our doctors tell them it's okay. Just make it fun. Have the child on your lap and make up stories about the picture. And this book, actually, that Tish wrote for us is so great. I love this book because she wrote questions that for the parent to ask about the picture, because you have to sort of be creative.
Right.
Not everybody's creative.
Right.
So, for example, this is a picture of dogs. What is the little puppy doing? And here, of course, the little puppy's reading. Of course. But it helps parents have that, what we call serve and return, that conversation with their kids. So as much as Reach Out and Read is developing early literacy skills, we're also helping to develop social emotional skills. So we're helping to develop that bond between a parent and a child, which is so important to early brain development. Children need a strong bond between a parent or a caregiver in order for the brain to develop normally. And so we want that, especially like we said in the beginning, the brain is developing faster in those first 3 years than any other time in their life.
Right, and actually studies have shown that if you begin reading to your child in the womb, that your child will recognize your voice once it's born and will react positively to your reading stories to them and to talking to them. It makes a stronger bond between child
I wonder
and
how the
parent.
unborn knows if you're reading or not. Like, and not just talking.
They probably, well, right.
Well, a lot of people read in a different tone than they do
than normal conversation.
normal talking. So babies also can recognize mother's favorite soap opera songs. So that is really true. So that there is proof that if you have a certain reading tone, a reading voice, your kid is going to recognize it.
That is very funny.
Now, with such a French name, were you born here or?
No, I was actually born in France.
In France,
Yes.
okay. So when you were little, how old were you when you came here?
So my mom is an American and my father's French. So I got the benefit of both worlds and grew up speaking both languages. I speak primarily English now, but
Did they read to you in both languages?
Yes, read to me in both languages, watched movies in both languages,
Wow.
songs, everything was just...
Oh, too bad. I'd like to hear more, but we only have 2 minutes.
Go ahead.
All right, you get to use the 2 minutes.
One of the things that I think that is a great way to pivot on is that a lot of our parents who are reading to their kids are actually bilingual speakers or native in another language. So when you give them a book that has bilingual captions, they're able to actually learn new vocabulary for themselves and to promote English with their children, which is huge.
So you
huge.
do bilingual books?
Oh, absolutely. I would say at least for
you guys
CHC
get
sites,
a lot.
we hand out primarily bilingual books, and
that's
so it's a
wonderful.
benefit to both the parent and the child in so many ways.
Wow, that's really good to know. Well, thank you so much for coming
Thank
on.
you, Lisa.
Thank
So
you.
much
Getting me
fun.
all excited.
Go home and read.
Yeah, I'm going to go home and read now. Well, thank you so much for joining us on the Lisa Saunders Show, and I will see you next week.